If running makes you wheeze, does that mean you shouldn't exercise or that you need to more than anyone? Today, we're breaking down how exercise actually affects asthma and how to move your body without feeling like you're dying. All that and more on today's episode of My Allergist Dad.
Throat tickle or itchy eye, skin rash or a patch of hives. If allergies got you down bad, then just ask my allergist dad.
Welcome to My Allergist Dad. I'm Drew, and I'm here with my dad, perennial top doc for allergy and immunology in Rhode Island, Dr. Z. Hey, Dad.
Hey, Drew.
How are you holding up in the weather?
It's, I already said to people, this is going to be a real winter. It was a lot colder last month, and it's winter. We haven't had a real winter in a long time. We've had winters like this. It seems when it rains, it pours. It's not just a little snow. We got 2 feet of snow.
Wow.
The roads are really narrow. And then once they plowed it, we received another 2 inches. And so it's quite the winter.
Well, that's good for dust mites, to kill dust mites, as we learned.
Correct. That's what I was thinking.
Leave all your stuffed animals in a trash bag outside.
This is the perfect time, especially with the wind chill factor.
Before we get into today's topic, I know you had a couple things you wanted to talk about.
Well, I think it's really interesting, and we use that word a lot.
We got to trademark that.
When we discuss a topic, and then since then, I have something come up that's very relatable for the patients. And in fact, one of my patients came to me as a new patient, and she had bad allergies. And when she told me she had a cat, I said, it might be your cat. She says, no, it's not my cat. She said, I was tested before I got a cat, and I was negative. Well, of course, she was positive to the cat. And I explained to her that you have a predisposition to develop allergies.
Is that by virtue of being atopic?
Correct.
Yeah, so if you're atopic, it's a term that means you have a predisposition, I think, to asthma, eczema, and certain allergies. So this patient is atopic, tested negative for cats, but has a predisposition to develop allergies, got a cat, and then developed a cat allergy.
They actually did a study about this, a similar study in a similar way, 60 some odd years ago in the 60s at Brown University. And what they showed, they tested Brown students who were freshmen and then again as seniors, particularly those who were not from Providence, who were from, for example, the West, other countries.
East Greenwich?
What they found was Connecticut,
they went out of state,
right?
They went out of country?
Out of state, Connecticut, didn't count. But anyway, what they found was
Fall River?
Many changed their sensitivity, and they gave it the 4-year rule, that after 4 years in a new environment, it's likely you develop allergen sensitivity to the new environment. All these people used to move to Arizona, had bad allergies in the East. They also brought new plants and stuff, but then they become allergic to the new area. It's about 4 years.
I still haven't really developed new allergies in California as far as I can tell, but...
Because it's dry.
Oh, well, but Arizona's dry.
But these people brought their trees and everything.
Does this work for food too?
What way?
Like, let's say I go in for allergy testing and I'm allergic to peanuts. I'm not allergic to almonds, so I eat a lot of almond butter. Is it possible that then by eating a lot of that, I develop an almond butter sensitivity if I'm atopic, or if I just am or just any person?
Well, you're eating it a lot, which means you're less likely to develop it. It's more intermittent. I see adults developing shellfish allergy.
Is that related to like hormonal changes, or is that just happening to anyone?
Well, that leads to the other question we asked the other day. Well, it's not just hormonal changes, it's lifestyle. And that would be a great segue to the asthma one and exercise.
Well, we can transition to that. So, today's question was, and this was submitted by a patient of allergy and asthma physicians of Rhode Island, my favorite allergy practice in the state, nay, the country, nay, the world. And the question was, what is the relationship / impact of exercise and asthma? And And before we get to answering that question, I wanted to talk about a video that our great producer Adam sent me that he found where he was talking about his life experience where he was able to get rid of his asthma by using ujjayi breathing anytime he was having an asthma attack or asthma episode. And the way he describes it is you start first by breathing out with your mouth as if you're fogging up a glass. And then you close your mouth and then you let air out of your nostrils. So it's like, and then you close your mouth, constrict your throat, and breathe in deeply through your nose into your belly. So, so there's some really good ASMR for any of you listeners looking for that. But that guy preached by practicing that for months whenever he had any asthma episodes. He was able to get rid of his asthma and get rid of his need for like inhalers or any other preventative stuff. Have you encountered any like breathing as a means of eliminating asthma?
Well, asthma is various different ways, but one of the things I would like to know in this person's case, I don't know anything about how do you say it?
Ujjayi.
Ujjayi breathing. But improving your breathing, there've always been discussions in asthma where you can be taught to control your breathing, and that will help your asthma. First of all, stress triggers asthma. And there's so many things going on.
I'm surprised I didn't have an asthma attack during the Pats-Broncos game. Am I right? What a stressful football game.
It's because you did your ujjayi breathing.
I didn't know about it. I wish I had known about it before the game.
Well, you saw the video. Maybe it was subconscious.
I noticed my heart rate was going up during the game, and I did try doing box breaths to calm myself down.
Yeah.
And I'm like, why? I've developed a real, maybe I've had it my whole life, but I've developed a real emotional reaction to watching sports. So that's a bigger conversation.
It's supposed to relax you.
Yeah, not playoff football.
Not you.
Not me, not
anyway,
playoff football.
The thing that's interesting is the way you describe ujjayi breathing meant that a lot of what his stuff, everything that was going on was in his upper airways, that you're controlling upper airways.
So what you're pointing out is that, and I think what you meant by a comment earlier is that there's different types of asthma and different ways that asthma is affecting us in different areas in our respiratory system that asthma may take place.
But it's also, is it asthma? I remember mine was more in the upper airways. It's where you're feeling it and what's happening.
So it could be like a panic attack that people diagnose as asthma.
There's something called pseudoasthma or vocal cord dysfunction, where the airways close up. Paradoxically, the vocal cords close instead of open, or the arytenoids around it close instead of open, and that creates an asthma-like situation.
Is that psychosomatic?
Well, it is subconscious, so maybe, but you have to go through speech therapy where you learn ways to open the vocal cords. And this ujjayi breathing sound to me like you could like open the vocal cords, because what we do for speech therapy is have it sort of open up paradoxically. But I also feel we talk about the neurotransmitters and the immune system and asthma. Relaxation exercise, special breathing may help relax the airways, and that may contribute to the improvement as well.
Is that something you would do preventatively, or is that like, I'm going for a run, I have an asthma attack, I don't have an inhaler, why don't I sit on the side of the road and do some breathing exercises?
Well, that might help for some people. It also rest on the side of the road may help too.
Yeah. But back to the question at hand, unless there's more you want to talk about this.
No, we can hold off. The basic thing that I was saying, just relatable, is that with your nephew Joey, he's all broken out in eczema. And I've discussed the importance of soak and seal. And we soaked him. We asked you to use the Crisco shortening that I always talk about.
Well, I learned about Crisco from Big Mama's house.
What?
I learned about Crisco from Big Mama's house. Do you remember when Big Mama needs to, Martin Lawrence pretending to be Big Mama, I'm pretty sure he's helping someone with childbirth and he's undercover as Big Mama. And for some reason, he asked for a bunch of Crisco, and I think it helps the person give birth.
Crisco does everything, but it also cleared the skin. It's
Because it
a
worked as a
multi-purpose.
sealant. So it's different than using
It's a very good sealant.
but it's different than using like a Vaseline or a moisturizer.
I actually think sometimes it works better.
But is Vaseline doing the same thing that you're using Crisco for?
Yes, but I think that the Crisco really holds in the moisture.
Can you fry a chicken with Vaseline?
I don't think so. But I think that what you should do is when you pack your first aid kit, you should bring the Crisco.
Oh, it'll smell good. I don't know if it'll get through TSA though. So I have some kind of like itchy thing on my forehead. I wonder if it's allergic contact dermatitis. Maybe I need to crack open the Crisco and put some of that on there.
I think you should do the Crisco after you shower. Do the Crisco as long as you're not going anywhere.
Crisco is vegetable lard, right?
I thought maybe. I thought it was just plain lard.
My fiance is vegan, so I just have to be careful. If she could help me if it's vegetable lard, but if it's not, then it might be harder to use. But let's get back to the topic at hand. What is the relationship / impact of exercise and asthma?
Well, I found it so interesting the way you asked the question, because it comes to me in several ways. Exercise is a common trigger of asthma in patients, but at the same time, many providers like to separate it out and specifically call it exercise-induced asthma. And they'll say to patients, you have cold-induced asthma, you have allergic asthma, and you have exercise-induced asthma. In addition, some patients worry about over-exercising. Is that going to make their asthma worse? And they don't want to get worse. So my opinion about all this is, especially when you're dealing with a young atopic asthmatic where allergens are a major trigger, I have repeatedly discussed that, in my opinion, in my experience with my patients and myself, addressing the allergies and reducing the allergies, possibly desensitizing or removing the allergen in the environment, is the best way to improve the exercise as a trigger of asthma. In my own experience, I spoke about how I went out west in a dust mite-free environment. My frequent exercise-induced asthma went in remission.
So does that call into question even the idea of like demarcating different kinds of asthma? Because if you're saying there's exercise, cold, and allergy-induced asthma, but you may be getting rid of exercise-induced asthma by getting rid of allergies, are they all just kind of allergic asthma that just get further triggered by little things?
What I like to say is it's asthma, and these are the various triggers. For patients with bad asthma, it can be worsening allergen exposure. The allergens lead to the inflammation that make the airways reactive, and they're more reactive to the triggers, be it they get a virus, be it they get exposed to an allergen, which makes it even worse, or exercise. I always speak about my patient who had cat allergies, and he had very mild asthma, and because it was so mild, exercise was a trigger, and he took his albuterol 2 puffs 15 minutes before and consistently ran 3 miles 3 times a week without breakthrough wheezing. That's the right treatment. You start by pre-treating it when it's mild. He is exposed 15 minutes to a cat, and that 15-minute cat exposure 3 days before his subsequent run made him wheeze and break through with asthma symptoms despite pre-treatment after a mile. So treating the allergic trigger improved his threshold for exercise. Similarly, you can, even with certain removing triggers, you hit enough of a trigger, you'll wheeze, but you improve your threshold.
So by this example, you're saying if you limit your exposure to allergens that you have, you're going to decrease the likelihood that you will get asthma. But at the same time, would you find that doing a desensitization program, either through allergy shots or allergy drops, would be a way to decrease your asthma as well?
Yes, and that's what I was able to do to myself. In a dust mite-free environment, my asthma was in remission. Moving back to a dust mite high environment with the desensitization, I got my asthma in remission.
Got it. So, I find this interesting, to use our favorite word, or at least relatable, because when I come home, my asthma feels worse. And I think it's because I'm going from this dry, dog free environment to a more humid, albeit hypoallergenic, dog inclusive environment. And I find that my wheezing can get a little worse when I'm visiting home.
And that's why I tell patients, you want to go after the inflammation. I'll even have patients who are used to go out west to their in-laws. I would say start a preventative daily asthma med, a controller with an inhaled steroid 3 or 4 days before, continue it 3 or 4 days after. I have kids who go to college who come back and they're reacting to the family pet. Start the treatment before, continue it while you're home on vacation.
So that's what we were talking about. Do some pre-gaming with your antihistamines, right?
Not antihistamines, with your inhaled steroids.
Start pre-gaming with your inhaled steroids. So your different
Yes, I like that word.
But inhaled steroids that's an inhaler, right? But
yes.
Inhaled steroid, that's the daily preventative. Is a rescue inhaler also an inhaled steroid?
No. Rescue. There are some rescue inhalers that are now combined with an inhaled steroid, but those are still as needed.
And what is in a rescue inhaler?
Well, that's the albuterol, the bronchodilator.
So albuterol is a bronchodilator. That means it opens up your airways?
Right. It's really not a pregame. It's a pregame for exercise. You take it 15 minutes before, but going after the allergic trigger that's causing the inflammation that's triggering the asthma, you need to use an inhaled steroid.
And the inhaled steroid is helping with
allergen-induced inflammation.
Because the steroid weakens your immune system, so you're not reacting as much to your allergens and thereby inducing more asthma.
No, that's not what's happening there.
Well,
that's at higher doses.
So then what is the daily inhaled steroid
It's
doing?
reducing the inflammation of the airways. It's triggered by what we call the late phase response of the allergen. So by reducing the airway obstruction, the inflammation of the airway lining,
you're breathing better.
You're breathing better because you're reducing the inflammation. We come back to it all the time. It's all about the inflammation. By reducing the inflammation or reducing the allergic trigger, which is not when you're going home, then you're less reactive.
It's like my grandmother used to say, it's not about the money, it's all about the money. But here we can say it's not about inflammation, it's all about inflammation.
You got it.
Okay, so when you take an inhaled daily steroid, that's because you probably have an inflamed airway, and that way you're reducing the inflammation so you can breathe better.
So when I spoke about the cat, it's what we call the late phase response. This man, it's classic. He was exposed to the cat. He had an acute asthma attack immediately, took his reliever med, his albuterol. He felt better, went home, said sayonara to the cat. He was there 15 minutes. 8 hours later, he woke up with another asthma attack. That's that late phase inflammatory response that triggered his asthma. He took albuterol, he was fine. And then 2 days later, he had the problem with the asthma. He ended up going on prednisone to reduce the inflammation. It's all from the one cat exposure.
Why did it linger so much if it was a one-time exposure? Was it that he didn't shower or had all the cat hair still on him?
No, it's an allergen-induced response, what we call an early and late phase response. The early is the immediate response. And if you were to look at a video, it shows other inflammatory factors coming in that trigger this ongoing inflammatory response. And that's what goes on. And a lot of what I find is when you're around the trigger chronically, for example, the dust mites or the pet, you start losing those immediate warning signs, but the inflammation persists.
So you don't have those initial acute ones, but you have chronic.
The chronic.
Not the hip hop album, but a chronic.
No, and the airway lumen gets smaller because of the inflammation.
The what?
The inside of the airway gets smaller and smaller. So instead of being this big, it starts shrinking from the inflammation, which is why people feel like they're breathing through a straw.
You said the airway lumen?
Yeah, that's the inside. That's what
The
it's
inside
called.
of the airway?
Yeah.
So in this instance then, is the relationship of exercise and asthma really just that exercise is a trigger for asthma as opposed to a cause? So it's just another thing that incites an asthma attack because it requires more breathing, or is exercise causing inflammation? Or is exercise just getting you to a threshold where whatever inflammation you already have is a problem?
So, Drew, you're bringing up a very interesting point. And that's because up until recently, it was felt that the exercise, especially on a cold day, was causing you to hyperventilate. And that hyperventilation of the cold air affected the mast cells, the allergy cells that led to the whole trigger of asthma. But now they find that these combination reliever meds, where they include an albuterol plus an inhaled steroid, in this case, budesonide.
So a bronchodilator plus a steroid.
Right. Those do better for treating and preventing exercise-induced exercise as a trigger than just albuterol alone. So it's a whole inflammatory response. They also show that the more humidified the air is, that's why when you run, if you wear a mask or a scarf outside in the cold air, then you'll find that prevents it, that you don't have it as bad. So it has something to do with the cold air.
So a more humid air will not cause as much asthma?
Correct.
So if I go running in New Orleans,
you'll probably have less problems than on a cold day where it's 20 degrees out and dry.
So the dry air is worse.
Dry, cold air.
Is there humid cold air, or does that not exist?
Sure. The high humidity right now related to the snow.
So if you're running out in high humidity cold
but
air,
the cold air outweighs the humidity.
It's just about temperature, but humidity can help mitigate.
Cold is bad.
So then is exercise not even the trigger, but exercise just makes you breathe more? And then if it's more cold air, cold is the trigger.
It seems that it's the breathing associated with exercise that's triggering it. It's not that you're exercising. So swimming is less likely to do it. So it's you're correct. It's the respiratory response associated with exercise.
Swimming's less likely to do it because when you're swimming, you're breathing less.
You're breathing in humidified air.
Or, okay, it's more humidified, not the frequency.
Right. But then it gets more complicated with swimming in an indoor pool. The chlorine's a trigger. But overall, swimming is a good exercise for asthmatics.
So swim in a saltwater pool.
Yeah, so that would be good. A point you brought up earlier is exercise bad for an asthmatic? Of course not. Exercise improves your whole lung efficiency, your whole body. And as we talked about, the healthier the baseline body, the more that they're in alignment, the more they have less fat and inflammation, the more they're going to breathe better and less they have asthma symptoms.
So the more you exercise to increase your respiratory health, your lung capacity, the more efficiently you'll be able to breathe when exercising, the less likely you'll have asthma from exercise.
That's right. It's why often parents with children with asthma would want me to write notes keeping them out of gym. And I would emphasize to them that's not something I want. I want them to exercise. I want them to participate. I want them to focus on getting their asthma under control, their allergic triggers under control, so that they can continue to exercise and participate in gym.
So here's a question then. If I'm taking my inhaler regularly to the point where I can now exercise comfortably and then I increase my lung capacity, am I ultimately going to get to a point where I can wean myself off of a daily inhaler?
I think the better way to look at it is that you want to address the allergic triggers, address what's behind your asthma, get the asthma under control. But the more you exercise, the more you're more efficient with your workouts, your threshold to react will be a lot higher. So if you're out of shape and you're running on a cold day, you might start wheezing within 5 minutes. Where if you're much more efficient, if your asthma is better controlled, but you now exercise all the time, you may not wheeze with that exercise that triggered before, or it may be that when you really push your exercise, it might be a much more higher level of exercise that ultimately triggers the asthma.
With exercise, you're either getting to the point where there is no threshold or just you have a higher threshold that would trigger your asthma.
It's like a car. You can have a car that's loaded with people, loaded with suitcases, loaded with weights, and it gets 10 miles to a gallon. You have one person driving the car. You get rid of all the excess stuff that you just keep in your trunk and get rid of the heavy weights, and suddenly you're doubling your mileage. It's the same thing. It's more efficient.
Speaking of a car, because I live in LA, do you find that air pollutants can be exercise asthma triggers or just asthma triggers? Like if I go for a run and there's a bad smog count, or air pollution index, am I more likely to have an asthma attack?
Yes. So high ozone, we spoke about how ozone high up is protective, down low triggers asthma, diesel exhaust, all of those things are more likely to trigger asthma. Running in clean air is always better.
So it kind of sounds like exercise is sort of a threshold trigger point for asthma, not necessarily a cause of asthma, but the higher breathing you do during exercise is more likely to maybe cause an asthma attack if you have inflamed airways, which may be an allergic response, a cold response, and what's important is figuring out what is leading to your inflammation and how to reduce that inflammation. Even if you have exercise-induced asthma, it's important to still find a way to exercise because that'll only increase your ability to exercise ultimately.
Exercise has so many positive benefits to your body and your mental state, all those things that trigger the asthma. It's exercise, it's the process of exercising, it's the hyperventilation, all of that, which you're going to ventilate less quickly as you become more efficient. So the more you're efficient with your exercise, the less it will trigger asthma. It's the processes associated with exercise, as we discussed, that triggers it, but not that you're exercising.
And that's a good segue because in probably a few minutes, I'm going to actually head over to the gym and exercise myself.
And I did before.
That's why you were a few minutes late.
Right, because I went swimming, which is very good.
Yeah. Was it a chlorine pool?
I think so.
That wasn't an irritant?
Not at all.
Well, your hair looks good.
I know.
Is that were you wearing a cap, a swim cap?
No, I have shampoo, but I use the shampoo that gets rid of the chlorine.
Smart.
Maybe I should wear one of those caps. It might be easier.
Maybe you should cover yourself in Crisco before you swim.
I don't know if the people at the pool would like that.
What about after?
Yeah, I would look really good for the podcast. People would be like, who's this guy with this greased down head? That would look pretty bad. On you, it wouldn't look so bad, but on me, it wouldn't look good.
But everybody in the office, when you walk by, would be like, ooh, who ordered KFC? Smells pretty good.
Or they might say, get the chicken.
Well, thank you for checking out the show. Hopefully we answered that patient's question. If you're enjoying these conversations, subscribe so you don't miss new episodes. It also helps more people find the show, which we really appreciate. Follow the link in our description to send us your questions so we can answer it on the show. You can also email myallergistdad@gmail.com. Before we go, Dad, any final thoughts?
No, this was good.
It was good. Well, pleasure as always, and I look forward to seeing you are you getting in Thursday or Friday?
Friday. And I hope people send more questions because it's always great answering their questions.
Send us more questions, and Dad, I'll see you in NOLA.
Bye.
If allergies got you down bad, then just ask my allergist.
My Allergist Dad podcast is for general informational and entertainment purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.